breathe in. And let it out. Let that drop. Yep. Perfect. Shoulder, let that go. There you go, little baby one. I saw you, it was a couple weeks ago, and then I saw you last week, and you were doing better, and the tape helped.
Yes.
We've got a low back injury you've had since, you remember, high school, right?
Yeah.
And there's
And I
probably some...
reheard it a lot.
And all throughout the years, you've reheard it, and this is your newest flare. I'm going to look at your back. Okay, so we still got my tape on there, and you're not sure if it helped this time. It did help the first time.
Definitely the first time.
So I'm going to go ahead and take this off. Excuse the little... But, because we can see if we need to redo it.
Okay.
But what we were chatting about was like, so this was... I usually tell people we got to do at least 3 visits. So after the first one, I see good results. After the second one, if anything weird is going to happen, it's after the second one.
Okay.
So there is a reason why I give people 3 visits. And then typically care goes on for longer than 3 visits. But when I'm first starting with someone, I know that for sure. So, and what else we know is that you're slightly lower on the right than on the left. You're not crazy off balance here today.
Okay.
Any pain here on the right?
Just tender.
And on the left?
Not as bad.
Okay, bring your right knee to your chest and down. Good, and left knee to your chest. But what's interesting about what's happening now bend forward and touch your toes, is that it's burning. Come back up. Is that as far as you can go?
Yeah.
And because of pain?
When you got me, it shows that I must not be doing it correctly.
What do you mean? So when I'm holding you, then it burns?
No, it's just harder.
And then come back up. Okay, now you do it without me.
Just, it almost felt like it was something pulling me back more so.
Okay.
I do feel like coming back up.
Yes.
I don't know if that's connected to the core stuff.
Yeah. Okay, so let's go into a plank position. We're going to...
This way?
Yeah, it doesn't matter.
Like push-up or plank? Okay.
Yeah, let's do push-up first. Because you're saying you can do squats, you can do lunges, you can do everything, but you cannot do a push-up position.
Yeah.
Now, is it burning now?
Not as bad as when I'm in elbow.
Okay, do elbow.
Yeah, so this is
and
really
then
burning.
it starts burning right in here. Okay. So I'm just going to check and see how we're doing for activation. So can you drop your... Okay, yeah, I feel that. Okay. All right, so then push back into kneeling. And then as soon as you get out of it, does it stop?
Then when I go like this, that is painful.
Okay.
In this position.
Okay, now stand all the way up. Okay, and now.
No burning when I'm just standing.
Okay, so what's interesting is that like you're in a non-weight bearing position and it hurts in that spot. So then we have to look at what are the other connections of the body that is causing this. More than likely, yeah, I'm sure we have some low back stuff to work on, but we're going to look at some of the other connections, and I'm going to look at the core.
Yeah.
We're going to look at breathing and diaphragm.
Okay.
Sound good?
Yes.
Good, and we're going to figure out a way to do it without you burning. So let's go on your stomach.
Okay.
Yeah, and like remember we were talking how, healing is not linear.
Yeah.
It rarely goes like I'm here, I get adjusted, and boom, I'm there.
Yeah.
It's a process, and we're working with your body and uncovering layers. Definitely plenty to do there. So as I look at your feet. Okay, all right, I'm going to take these off now, just so I can, perfect. There we go, I just get it all out in the open. Good.
Like when you do that, that wraps around and hurts in my stomach.
While you're lying there, does it hurt?
It's just not comfortable. Like, I would never want to, like, sleep on my tummy.
Mm-hmm.
What does that do?
The activator?
Uh-huh.
It makes adjustments to the spine and the other joints,
Okay.
like it does with my hands. Except for it makes the adjustment faster than I
Okay.
can with my hands, so it needs less force.
Okay.
And then I can be very specific with it. So
Okay.
what I like about that is, like with the shoulder or the hip or the knee, I can take out rotation. I can take out
Okay.
posteriority. I can, you know,
I see.
I'm
Okay.
being very specific and mindful of what I am changing in the relationship in the joint. And also, I don't want anyone messing with my knee, like trying to crack my knee. So.
Oh, yeah.
Most of the time, I adjust the way I want to be adjusted. And, you know, and as a high-level athlete,
Yeah.
the little things matter. How's that feel when this does this, when you go up and down?
When it gets to the down part, there's a little bit of pain.
On this right side?
Yeah.
Okay. So, there may be some... Let's see what I can find. Interesting. So I'm going to adjust your sacrum. I'm going to have you scoot towards your feet just a little bit. A little bit more. Perfect. Okay. Does that feel any different?
Yeah, it's a little bit better.
Yeah, so there's some rotation in your sacrum. Squeeze your butt together. Release, good. Okay, it's not the coccyx. Let's check your hips. Okay, how's that feeling here?
Tender.
Just on the left side. How about on the right?
Same. Tender.
How about in here?
That's a little painful.
On both sides?
Yeah. More so on this side.
Yeah, that's your G medius. So let's work on that first before I go any further. Lie on your left side. Good. Okay, so we're going to bend the bottom knee, keep this top leg straight. Perfect. In there?
Oh, yeah.
Did we do this last time?
No, maybe the first time.
Okay, well, we're going to do this today. I'm going to work in this right gluteus medius. I'm just in my brain trying to make all the connections with all the positions you're noticing it. So. All right, so I want you to bring your knee to your chest. Keep going, keep going. Good, and come back. And I also wanted to mention how perfectly we matched here today. Right knee to your chest. Good, and come back. Go ahead.
Feels like a foam roller.
Like I'm finding the spot?
Yeah.
Go ahead. Good, and come back. Go ahead. Good, and come back. Go ahead. Good, good, good. Okay. Now I want you to scoot towards me with your body. Come towards the edge. Sorry, that was confusing. You're like, climb on the headrest.
Terminology by now.
There we go. Perfect. Nice deep breath. All the way out. Drop that shoulder back. Hook that foot. Let it drop open. Yes, let's go all the way open. Okay, got a little baby one, and then we'll go the other way. Okay. Hi.
Oh no.
I'm feeling. Okay. I found it. Okay, good. Straighten up. Let's go. Perfect. Good. Okay. Breathe in. And let it out. Let that drop. Yep. Perfect. Okay. Let's go back on your stomach. I want to recheck. All right, now. How's that feel now?
Still tender, but feels like it was easier.
Okay. Okay, I'm gonna work in the hip. Okay, and how about now?
A little less pain.
Okay, raise your right knee, or sorry, right leg to the ceiling. Okay, and down. Any pain with that?
No.
Okay, do the other one. How about that and down? Any problem with that side?
Not pain, just tugging a little bit.
On which side?
I felt it in here when I looked this way.
Yes, okay.
Okay.
That's what I'm, what are you recruiting? Okay, so on this side, I'm gonna adjust that one when I flip you over, so. Nice big breath. And all the way out. Good. Big breath. And out. Good. Let that drop all the way. Good. That's kind of a volunteer. Okay, so now if I come in here, do you still feel that
Yeah.
on both sides?
Yeah.
Okay.
But
So,
just that like foam roller kind of sensation, not like unbearable pain. Just I notice it.
Yeah. But nothing up in here.
No. Right there, little. The wraps around my core.
Right here.
Yeah.
Mm-hmm. I'm going to have you scoot more towards your feet. There. So I'm going to use the table. I'm going to adjust L4. Okay, so raise the left leg up. Got a little higher. How did that feel? Any easier?
A little easier.
A little bit. Okay, and the right leg.
Much easier.
Okay, so the right leg, so the restriction. So let's release some on the left. Lie on your right side, please. So we're figuring out puzzles real time here. Go up on your side. I mean, we may have coordinated our outfits, but... On this side, where do you notice this? Oh, in here?
Yeah.
Same as the other side. Is this side worse?
They were both, I think, equal pain.
Okay, all right. So let's do a couple passes like this, and then I'm going to do a little scraping there.
Okay.
So bring your knee to your chest. Then come back.
I think it's not as bad as the other side.
Go ahead. Unless I find another spot. Go ahead. Mm-hmm. Mm-hmm. Now last one. Okay. All right. Actually, stay there. Relax that leg. So it's a little higher on this side. Because where we feel the pain isn't always where the problem is. So that's why I'm looking opposite side. And then also when you're doing a plank, you have a lot of oppositional forces, right? Yeah. And so if you're in a plank position and you're having burning on the right, that means the right side is doing more than it needs to.
Yes.
So weakness is in the actual core, but also what's happening on the left side causing the right to work. Now you have, things to adjust like L4 and the femurs. You okay?
Yeah.
Yeah, it's a lot. I know. All right. So now go on your stomach. I want to see how that movement changes. Okay, so raise the left leg up. Wow.
Yeah, it's much better.
Yeah, so you got higher on the left, way higher, and it was easier.
Yeah.
Okay.
I didn't wrap around or anything.
Okay, yep, good. So I want to see things take some time to actually get better, but I want to see changes immediately.
Yeah.
Let's go on your back and adjust your neck.
Okay.
And then we'll retry the plank.
Okay.
Maybe we'll actually look at your breathing here. How are you breathing these days?
Breathing?
Yeah, are you breathing?
I think so.
Not breathing, breathing.
Not breathing.
You already did that.
Oh. Breathing is very interesting, though.
Mm-hmm. Off screen. Shoulder, let that go. There you go, little baby one. Well, that was something.
Yeah.
making sure. Okay, quiet toes today. How's that feel in the back?
It's noticeable.
Meaning you can feel it.
Yeah.
And this is the left side that I wanted to adjust while you're here, so let's do that. How's that feel in the back now?
A little easier.
So the hips and the low back are they work together and cause, either one can cause some of the issues. Okay, let's do a little breathing check. Okay, so I just want you to breathe deep for me. And out. And breathe. And out. Breathe. And out. So we have more rib flare on this side. This one is tucked in. So even without you breathing, we can see that this is sticking, it's flared out, right? So is that tender in there?
Not too bad.
Maybe I need to push harder. Breathe in and out. Breathe in and out. There we go. Good. Breathe in and out. Yes, there we go. Good. Breathe in and out. Good job.
Never had that before.
So one of the things you're going to do is probably have you actually do child's pose breathing. Actually, let's do that. So go on, you know how to get in child's pose? Yeah, let's do that right on the table. I'm gonna clip this on. Good, okay. Yeah, so yeah, perfect. So what I want you to do is I want you to breathe into your pelvis like you're blowing it up like a balloon. And blow it out. Okay, good. And breathe in and out. Okay, how's that feel in the back here? Any pulling?
Yeah.
Where do you feel?
Not pain, mainly up here.
Oh, you feel?
Yeah.
Okay, yeah.
But no pain in my lower back in this
So
position.
do whatever you can. Yeah, relax the hand and rest the head down.
Okay.
Good. And now breathe in and out. Good. And breathe in and out. Good. So we're really practicing lateral expansion with the rib cage. Breathe in. Yeah, into my hands. Good. And out. And then do you feel that sensation where you're breathing into your pelvis and blowing it up like a balloon?
Yeah.
Breathe in and out. Because we want to create some expansion in this area.
Okay.
Okay, so that's practice. That's homework.
Okay.
All right, so now let's try a plank again.
Okay.
So everything's been adjusted.
On here?
Yeah.
Okay. Not on the bed.
Do everything the same, right, because I want to
Okay.
see. So start with the hands, right? Okay?
Yeah, in here.
Okay, so that's
Like right
gluteus medius.
here.
Okay. Can you do a side plank?
on my
Do you
right or
want to do
left?
this side? Either way, I want you to do.
No burning on this side. But I
Okay.
think if I was to
Yep.
so
So it's happening. Yeah, you
Yeah,
don't
that's-
have that. Yep.
That's burning in here.
Okay, so, all right, so come back up. So it's definitely an activation.
Okay.
Let's see if I can demonstrate this.
Yeah.
So if we're doing side plank, because that's where we're going to see it, right?
Okay.
So side plank is going to be here, and we want to be able to lift this hip up, and we're using all of this, right, to,
Yes.
to hold ourselves up. So we want to be able to, so I think we're going to do it like this. We're going to try to bring this foot out, and we're going to lift up.
Okay.
We got to activate the adductors.
Okay.
What's a better way to do it? Because that takes a lot. And if you're burning here, that's going to be a problem.
Okay. I
So-
can maybe do it with
Go
my
on your back. Lie on your back.
on my back.
We're going to try a different way of activating. Because it's definitely have to make those stronger. So I want you to squeeze. You're going to squeeze in. So push your knees out. Push out. Any burning? Good. Okay, now squeeze in. Any issues?
More so, but not as bad.
So that's, I want you to do internal and external. So you, like your foam roller, so squeeze into the foam roller. So you're activating all of the inner,
Okay.
and then let it go. And then you can squeeze out like that. Like if you have a band, if you
Oh,
get a
yes,
band
yeah.
around, so on the outside you're squeezing against the band,
Okay.
and then in you're squeezing into the foam
Okay.
roller.
Yeah.
Because when you're on your side, it's more apparent, but you're not activating
Okay.
here, here, here.
Yeah.
So that's putting pressure right there.
Okay.
And that's why you're burning there. So
Okay.
we're going to work on, so you're going to do the expansive breathing. So
Okay.
in child's pose, breathing into your bottom,
Okay.
and practicing that.
Okay.
Because we have some imbalance there
Yeah.
in the rib.
That's crazy.
Isn't that?
How
Yeah,
does
so
that
it's still a little
happen?
bit there. Well, I think our ribs flare like for lots of reasons, but like imbalances, stress,
Never even
babies,
noticed that.
right?
I actually can feel the difference.
And you might not be doing planks
Yeah.
right now.
Yeah.
But let's stand up. Let me check. Let's see if there's anything else I can do. Okay, so nothing happens when you're standing. Turn and face that way. You feel good.
Yes.
Feet together. Hold here. Right foot forward. Hold there. So you're strong. Hold this strong. And I can touch, I'm touching here, I'm touching here, I'm touching this rib cage, but as I come to the left rib cage, okay, now it's not working. And when I pull it back, so there's some rotation happening right here. So
Okay.
relax your arm.
Okay.
I'm still working on this puzzle. It's been that kind of a day. I had lots of puzzles today.
Aw.
And sometimes I can't, I can't explain things because I can just see them. Or I
Yeah.
can just feel it. Hold the arm strong here. Okay, so now if I pull back, that's strong, that's strong. Okay, now switch, put your left foot forward. Same arm, relax that.
Sorry.
Yep, hold this one up strong here. Let me check the hips. Okay, all right, we try it one more time?
Plank. Or side plank.
Yeah.
Okay.
What do you feel?
Less burning.
Less burning. So I've identified that this lower ribs,
Okay.
the flare on this left side is related to rotation throughout the thoracic spine here, which is also creating some of that.
Okay.
Now where are you at?
No burning.
Okay,
Just
go to your-
normal plank shaking.
Okay, yeah, go to your elbows. You're like, come on. What do we got?
Less burning a lot. Almost known. Actually, yeah. Probably not the same feeling I had before.
Okay, it's So sometimes it just takes a minute to kind of work with. Okay, now you can go on your knees. Good. So you got a couple of things to practice here.
Yes.
You're going to do the breathing, and I want you to practice activating the inner and the outer.
With a
right?
band.
Right? Because when we do big motions like squat, you have plenty of strong muscles to hold everything together.
Yeah.
But when you isolate and you're, trying to, and these are weak or these are weak, then we're going to have some imbalances.
Okay.
So we'll just keep working on, so we're going to breathe. We're going to work the adductors, and then just, play with the plank and see what you can do. Don't overdo it in that position because we still have some strength to do.
Yes. To build that up.
The other one I really like for working the core is nothing to do with crunches, but it's a quadruped. So go on your hands and knees up on the table.
Oh, yeah.
You're in this position. You're going to drop your belly into my hand. So just let it drop. And now you're going to, without moving your back, pull your belly button to your spine, right? You feel all of these, what are those called? The transverse abdominis, which is the deepest, and then these muscles on the side here, transverse. So we want to activate those. That's with the core. So now drop your belly. Good, drop the belly. That's it. Now don't move your back, pull the belly up. And doesn't that work more than anything?
That's crazy.
Right? Right?
It's so mental too.
Right, and so this is going to be your armor to support all of this, whatever the injury was, right?
Awesome.
So a couple things.
Oh, that's
I'll tape you up and then we'll set you free.
Okay.
But
Awesome.
thanks for coming along while we did a puzzle today.
Thank you.
Like and subscribe for Amber.